want to go over some basic principles of the NP3 test. I think understanding the basic principles of what we're testing and what we're measuring for will make it easier for you to understand placement of the electrodes and performing the test. So what we have done already is this patient has already been hooked up for the initiation of the test. The patient provided a trigger in their right hand. They're going to be instructed to press the trigger one time once they note onset of discomfort once we apply pressure. In this case, we will be using algometry. The algometry is designed to provide pressure. It records the amount of pressure being applied. We can then determine how much pressure the patient tolerates at a given time to onset of discomfort, and then measure their physiologic response to that painful stimulus. To measure the physiologic response, we have hooked up electrodes to the fingertips. These two are designed to measure the skin response, essentially the sweating response on the surface of the skin, blood volume, pressure, and heart rate. So we're basically measuring pulse and blood volume pressure. These are parameters that are increased when as a result of an autonomic response to painful stimulus. In addition, we'll be measuring surface EMGs. These two, as we've discussed, are what we call neutral sites. These are going to be away from our testing site. And then we will have surface EMG, basically again measuring muscle activity. These will be closer to our testing site. When we begin the test, we are going to be doing 3 separate stimulation trials at each one of these locations. These are symptomatic sites. We're going to go symptomatic site 1, 3 trials where we're going to be applying pressure. As we apply the pressure, when the patient reaches onset of discomfort, they will depress the trigger and we will hold that pressure. The NP3 test will be recording the patient's physiologic response to that painful stimulus. We will then go to control site 1, 3 trials here, then to symptomatic site 2 and control site 2, 3 trials at each, and that will be a complete test.